This is a model of the human heart, and the purpose of this video is to learn three basic things about the human heart. One is to learn the chambers of the heart. The second one is to learn the valves of the heart. And the third one is to learn the great vessels, the vessels that enter and leave the heart. This is an anterior portion view of the heart. It is an anatomical position, so its right is your left and its left is your right. So don't forget that as we look through it. That's a very important aspect of the anatomy of the heart, to make sure you realize which is the right side and the left side. Because you know that the right side sends blood to the lungs and the left side sends blood to the body, the pulmonary and systemic circuits. The right side for the pulmonary circuit and the left side is the systemic circuit. So let's look at this. And the atria, which are the thinner wall vessels, are on the top part of the heart. Okay, this would be the right atria, this would be the left atria. Then the ventricles are on the inferior part of the heart. This would be the right ventricle and this would be the left ventricle. Also, you can see this is called what? The apex of the heart, and the part where the vessels are attached is called the base of the heart. It's a very strange arrangement, because we usually think of bases as being at the bottom, but the base of the heart is at the top. Now, what I've done is removed a piece from the front. This piece I took off, and so now we can see the heart from the front, but it now has been separated front and back, and that's a frontal section or coronal section. Now let's first identify the chambers, because that was the first objective. This is the right atrium. Okay. Remember, it's on your left side, but it is the right atrium. This over here is the left atrium. Okay. This is the right ventricle, and this is the left ventricle. Okay. Right atrium, left atrium, right ventricle, left ventricle. Okay. So now we know the chambers, and you just to keep those straight, you just got to know it's in anatomical position. So the other thing is, the atria are thinner walled vessels with lower pressure, and they pump blood within the heart. And the ventricles have very thick walls. They have, the myocardium is very well developed, the cardiac muscle, and they pump blood out of the heart. The right atrium pumps blood to the right ventricle, and the left atrium pumps blood to the left ventricle. And we find valves between those. We find over here, between the right atrium and the right ventricle, we find the tricuspid valve. That's this one right here. Between the left atrium and the left ventricle, we find the bicuspid valve, which is also called the mitral valve, after the bishop's mitre. The two parts look like a bishop's headgear. Okay. Now we also need to look at the ventricles. The ventricles pump blood out of the heart. The right side of the heart, the right ventricle, pumps it out through the pulmonary trunk. We'll talk about this in a minute. And that's going to the lungs. and the left ventricle pumps it out of the aorta, and that is going to the whole body system. The right ventricle, the right side of the heart, is the pulmonary side going to the lungs, and the left side of the heart is pumping blood through the aorta to the body. That's the systemic part of the circulation. Okay. So now we got to look at, there are valves between the ventricles, between the right ventricle and the pulmonary trunk. There is a semilunar valve, pulmonary semilunar valve. I'll reposition the model in a minute so you can see that. And then between the left ventricle and the aorta, there's a valve called the aortic valve, or aortic semilunar valve. So let's move the model a little bit so we can see those valves. Okay. If you look right there, the one you're looking at right now is an aortic semilunar valve, okay, going to the aorta. And then there's also a pulmonary semilunar valve, aortic semilunar valve, and a pulmonary semilunar valve. And the route of blood through the heart is like this. It comes in first to the right atrium. Let me angle that a little bit so you can see the right atrium. Then it goes into the right ventricle, out the pulmonary trunk to the lungs, and then back in the left atrium to the left ventricle, and then out the aorta to the body. So it's what? Right atrium, right ventricle, pulmonary trunk to the lungs, back from the lungs into the left atrium, into the left ventricle, and then out the aorta to the body. Okay, so now we've seen the chambers and the valves. Let's look at the great vessels. The vessels that enter and exit the heart are called the great vessels, and they attach to the heart at the base, which is at the top of the heart. Remember, the apex is at the inferior end, the superior end is the base of the heart. So let's move from one direction to the other. This vessel right here is the superior vena cava. Okay, superior vena cava. The next one is the aorta. This is the ascending aorta, the arch of the aorta, and then it goes down to the descending aorta. Okay. This is the pulmonary trunk, which is going to divide into right and left pulmonary arteries. The pulmonary trunk is an artery because it's carrying blood away from the heart. Arteries carry blood away from the heart, and veins carry it back to the heart. Okay. Now there's one that we miss because we don't see it on the superior part of the heart. We have to turn the heart around and look down here, and this is the inferior vena cava. See, the inferior vena cava drains blood from the lower part of the body, and the superior vena cava, which is up here, drains blood from the upper part of the body. Okay. So let's turn it around over here again. So the great vessels that we've looked at so far, we've looked at what? This is the superior vena cava. It's a vein. Then this one is the aorta. It's an artery. This one is the pulmonary trunk. It's also an artery. And then the inferior vena cava down here is also a vein draining the lower part of the body. Okay. Now, let's turn it back around, and we will see the pulmonary trunk right here. As soon as it comes out of the right ventricle, as soon as it comes out of the right ventricle, it branches. So let's see if we can get a look at that branching. It's kind of hard to see. Well, you can see it here. Here is a, let me get my orientation. That would be the left pulmonary artery, okay? And this would be the right pulmonary artery. The left pulmonary artery is going to the left lung, and the right pulmonary artery is going to the right lung, okay? And then, of course, those go through the lungs, and now they're coming back. So these red things are the pulmonary veins. Don't get confused. They're red because they have oxygenated blood in it. They're coming back from the lungs. That's what happened in the lungs. They got oxygenated. Okay. So the blue ones are the pulmonary arteries, and they branched off the pulmonary trunk. The left one and the right one. These would be the left pulmonary veins, and these would be the right pulmonary veins, and they are going back into the the left atrium of the heart. They're going back into the left atrium of the heart. Okay, there's one more thing we need to take a look at, and I need to take this little piece. You can see it best here if I hold it up right here. This is the piece I took off of the heart. You can see there is a circulation to the heart. There are arteries and veins to the heart. So those are called coronary vessels, coronary arteries and coronary veins. And those are there because all the blood passing through the heart is not used by the heart. It doesn't break down into capillary beds to supply the tissue, but the coronary circulation does. And so this is the blood supply for the heart. The volume of blood going through the inside of the heart is not utilized by the heart. It's there as a service to pump it to the rest of the body and to the lungs. Okay. So now let's review what we learned. We learned the 4 chambers of the heart. Okay. This one would be what? The right atrium. This would be the left atrium. This would be the right ventricle and the left ventricle. Now the passing of blood through the heart, it comes from venous return into the right atrium to the right ventricle, then out through the pulmonary trunk to the lungs, back from the lungs into the left atrium, left atrium, into the left ventricle, and then out the aorta to the body. So we learned the chambers of the heart and the order in which the blood goes through it. Okay. We also learned the valves of the heart. On the right side of the heart, we have the tricuspid valve between the right atrium and the right ventricle. On the left side, we have the bicuspid or mitral valve between the right atrium and the right ventricle. And then we have semilunar valves. We have aortic semilunar valves between the left atrium and the aorta, and then we have a pulmonary semilunar valve between the left ventricle and the pulmonary trunk. You can see what the semilunar valve looks like from here. Okay? And the valves are basically to prevent backflow. You have a video that shows you how to listen for the heart sounds, which are made by the closing of those valves. Now the last thing that we want to look at are the great vessels of the heart. This one right here is what? The superior vena cava. This one right here is what? The aorta. Okay. This one right here is the pulmonary trunk. And then the one down below, down here, is the inferior vena cava. Remember, the superior vena cava drains the upper part of the body, and the inferior vena cava drains the lower part of the body, and they drain into the right atrium. Okay. And then we got to look at the other part of the circulation. When the pulmonary trunk comes out, it divides into the left pulmonary trunk and the right pulmonary trunk, which go to the lungs. And then these are what? The right pulmonary veins and the left pulmonary veins, which are draining blood back into the left atrium. Okay, so there you have it. Those are the chambers, the valves, and the great vessels of the heart.